Now, the different causes of primary, secondary, and tertiary type of hyperparathyroidism. First, the primary hyperparathyroidism. The parathyroid adenoma is the very common cause of primary hyperparathyroidism, and its adenoma is a small tumor in the parathyroid gland. Then hyperplasia. Hyperplasia is increase in the number of the cell, and they cause hyperparathyroidism also, which is the cause of primary hyperparathyroidism. Carcinoma is another cause of primary hyperparathyroidism. Familial hypocalciuric hypercalcemia. This is another cause of primary hyperparathyroidism. Hyperparathyroid jaw tumor. Then we have hyperparathyroid jaw tumor syndrome is also present, and that also causes primary hyperparathyroidism. Familial isolated hyperparathyroidism, only it's isolated hyperparathyroidism, no syndrome, not associated with any other condition. Then some causes of secondary type of hyperparathyroidism is inhibition of bone resorption, decreased calcium level, and renal failure. These are three common causes of secondary type of hyperparathyroidism. And the third, tertiary hyperparathyroidism, is due to autonomous hypersecretion of parathormone or parathyroid hormone, and then after renal transplantation, usually we have tertiary type of hyperparathyroidism. So these are some common causes of primary, secondary, and tertiary hyperparathyroidism. So the three main causes of the primary hyperparathyroidism are the adenomas, hyperplasia, and the carcinoma of the parathyroid gland. So if we discuss the prevalence of these three main causes of the primary hyperparathyroidism, the single parathyroid adenoma is the most common. 85% of the people have single parathyroid or adenoma, which is the cause of primary hyperparathyroidism. Next, if you see multiple parathyroid adenoma, we have on the two parathyroid glands, there are adenomas, multiple adenomas present. So this is about 10% of people have multiple parathyroid adenomas. Next, the hyperplasia, 5% of people have all four glands overactive. These are the hyperplasias. And then the parathyroid carcinoma is less than 0.1%. So main causes of primary hyperparathyroidism are the adenomas, then hyperplasia, and then carcinoma. And if we talk about these three main causes, single adenoma is most common, then we have multiple adenomas, then hyperplasia, and the least common is the cancer, and they are the main causes of primary hyperparathyroidism.